Welcome to OpenSkin. Today we are presenting a clinical case of an appendectomy. Before we begin, please note that this video is for medical education and public health information purposes only. The patient presented with acute abdominal pain, specifically in the lower right quadrant. After a clinical evaluation, a diagnosis of acute appendicitis was confirmed, necessitating surgical intervention. We begin with a precise incision to access the peritoneal cavity. Notice how the surgeon carefully dissects the surrounding tissue to isolate the inflamed appendix. Maintaining a clear surgical field is crucial to avoid any complications. The base of the appendix is now carefully ligated. This step ensures that the connection to the cecum is securely closed before the inflamed organ is removed. Precision in this step is vital for a successful recovery. The appendix has been successfully removed and sent for pathological analysis. The area is cleaned and the incision is closed with professional suturing. The patient is expected to make a full recovery. Thank you for watching this clinical session on OpenSkin.